Toronto Public Health wants to cut $9 million, 423 jobs from COVID-19 response. So that's just the city of Toronto. One city in this whole country, and it's just Toronto Public Health. That's a public health agency. That's not a hospital or a clinic. It's just bureaucrats, the busybodies, the city level Theresa Tams and Anthony Fauci's. Every city in Canada has a public health agency and a public health officer, and every province does, and every regional health authority or whatever it's called in your province. It's incredible, the number. Oh, and they are handsomely paid. I should remind you, Theresa Tam alone makes $250,000 a year. She doesn't have any patients. She does not do medicine. It makes me laugh when people like her are called top doctors. How are they the top doctor? Maybe in salary, but maybe in political power, but they're not actual top doctors. They're powerful, unelected, unaccountable bureaucrats, that's for sure. They were never elected to do anything. They have uniformly exceeded their legal authority, and Toronto alone had 423 of them, but how are they in the top in anything? They're not the best in their field. Still, to this day, there's 423 of these COVID bureaucrats. Actually, to be more precise, that's just the number that they're proposing to cut back. They're not cutting back to zero. Here, I'll read from the actual story. Toronto Public Health wants to cut more than $9 million from its COVID-19 funding and over 400 jobs next year as it transitions away from its heightened response at the peak of the pandemic. Yeah, that's been over for a couple of years, folks. The city's health agency submitted its 2023 operating budget to the Board of Health Committee for consideration last week and is proposing an overall budget of over $369 million and 2,309.9 positions. The budget is an overall decrease of $1.2 million and 423.9 positions lower than the 2022 approved operating budget. So they still have 2,309.9 positions. I'm not sure what the 0.9 position means, but it's still more than 2,300. These are not doctors actually doing doctoring. They're bureaucrats. They're just cutting a small slice of them. This line made me chuckle. It is not clear what the reduction in COVID-19 funding will impact. Exactly. I mean, you know that even the professional scaremongers are no longer pretending that we're in a pandemic, right? I mean, you know that, right? The chief grifter, Theresa Tam, she switched to global warming fear-mongering months ago. This is back in April, I think. Climate change is affecting our health today and will continue to do so in the future. Its impacts are broad and can range from heat waves to disruptions to our food systems. Together, let's take daily actionable steps and invest in our planet, Earth Day. She knows that no one believes the pandemic hype anymore, other than the 2,309.9 people in Toronto who are paid to gin up fear. So there's obviously no shortage of money. $250 million for bureaucrats at the city level in Toronto alone. Imagine what the total number is across Canada. But let me show you another story about public health. What's the difference between public health, by the way, and between actual medicine? Well, public health is another way of saying health politics. Medicine is about helping a particular patient. It's private. It's between a doctor and a patient, and no one else is involved. It's individualized care tailored to that person. Their whole situation, including mental and physical and their history. You get to know your doctor. He knows your story. Public health is the opposite. It treats us all as interchangeable, like ants in an ant colony. There's no privacy. You must disclose your information to the government. No personalized care. You must all take the jab, no matter what. No freedom of choice. You could lose your job or access to public life if you refuse to obey. What a disgrace it is. You know, look at this next story because it's similar, and I'll explain the overlap. Canadian doctors encouraged to bring up medically assisted death before their patients do. Oh, really? A guidance document produced by Canada's providers of medically assisted death states that doctors have a professional obligation to bring up MAID. MAID, they use that word because it hides the meaning of what they're up to, MAID. Even spelling it out is politics. It's assisted suicide. It's euthanasia. It's culling the weak, the old, the sick. It's not medicine. It's anti-medicine. It's anti-healthcare. It's public health, not medicine. It's eugenics. It's the kind of thing that the Nazis did, getting rid of undesirables. I refer to the Nazis specifically and on purpose and not in an overheated way, because it was the Nazis who dressed up their radical racial and eugenics policies as public health. There were plenty of doctors involved in their final solution. And after the Second World War, after the Holocaust, there were the doctors' trials, the Nazi doctor trials, from which the West developed what was called the Nuremberg Code, which were rules that limited what doctors could do to patients. It involved informed consent. It was the moral and legal bulwark against the kind of atrocities the Nazis had committed. It was expanding on the Hippocratic Oath, do no harm, do no harm. That's the motto of doctors. Of course, we just detonated the Nuremberg Code and the concept of informed consent during the pandemic, didn't we, with forced vaccines? Like I say, there's a big difference between public health and actual medical care. I'll read some more from this latest story. In most jurisdictions in the world with legalized euthanasia, doctors are explicitly prohibited or strongly discouraged from raising assisted dying with a patient. The request must come from the person. But a guidance document produced by Canada's providers of medically assisted death states that doctors have a professional obligation to bring up MAID as an option when it's, quote, medically relevant, and the person is likely eligible as part of the informed consent process. But of course, just like Orwell called the propaganda ministry in the book 1984 the Ministry of Truth, and the War Department was called the Ministry of Peace, you now have death doctors promoting suicide in the name of public health. Who's promoting this? Who's behind this? I don't know. Maybe it's one of the usual suspects like this guy.
It's an average about 5 tons for everyone on the planet. And somehow we have to make changes that will bring that down to zero. It's been constantly going up. It's only various economic changes that have even flattened it at all. So we have to go from rapidly rising to falling and falling all the way to zero. This equation has 4 factors, a little bit of multiplication. So you've got a thing on the left, CO2, that you want to get to zero. And that's going to be based on the number of people, the services each person's using on average, the energy on average for each service, and the CO2 being put out per unit of energy. So let's look at each one of these and see how we can get this down to zero. Probably one of these numbers is going to have to get pretty near to zero. That's back from high school algebra. But let's take a look. First, we've got population. The world today has 6.8 billion people. That's headed up to about 9 billion. Now, if we do a really great job on new vaccines, healthcare, reproductive health services, we could lower that by perhaps 10 or 15%.
Could be. He's always banging on about how there are too many people in the world. We have to get rid of maybe 1 billion of them. Here's the chief eugenicist promoting this suicide. Dr. Konya Truton is a physician based on Vancouver Island. She has been involved in social justice aspects of healthcare since medical school. Dr. Troughton is a founding member of the Canadian Association of MAID Assessors and Providers and continues to be an active board member promoting education to medical assistants in dying in Canada. She would have fit right in Germany in the 1930s. So many people needed coaxing towards suicide, didn't they? What you just saw was an excerpt from my nightly show, the Ezra Levant Show. Every weekday, I do a monologue. Usually it's about half an hour. Then I interview an interesting guest, and then we read my hate mail or my fan mail, whichever is more fun. It's only available behind a paywall, though. That's how we pay our bills here at Rebel News. We don't take a dime from Justin Trudeau. But the good news is it's only $8 a month, about half the price of Netflix. And in addition to my nightly show, you also get weekly shows from 4 other friends here at Rebel News. So you're getting 36 shows a month just for $8. I think it's worth it. And even if you're not quite sure, do it anyways, because we rely on viewers like you to keep us free and independent. I promise you I'll never take a dime from Trudeau. Just go to rebelnewsplus.com and click subscribe. Thanks.